Does the hospital have good leadership in position in the local and regional market? Are they well thought of? Or are they really kind of a second-tier hospital? You need to consider that when you start thinking about hospital partnerships. Does the hospital have up-to-date facilities? And why that's important is because one of the things that you're looking to do is how do I leverage capital? And so if the hospital hasn't invested in capital, invested in their own facilities, haven't invested in their own labs or imaging departments, it would be a little concerning to walk into a relationship to think you're going to have access to all this capital when they haven't spent it themselves to update their facilities. What about the primary care base? This is very important to know because if you're a specialist looking to get referrals, if they don't have a primary care base, then that needs to be a little red flag of understanding what is their approach on securing a primary care base that might generate referrals to you in the future. Do they have trusted and effective CEO and senior leadership? This is very important as well because as you start walking through it, one of the first things you're going to do is develop a relationship with the senior leadership team. And part of that's going to give you the comfort and trust to do a transaction or alignment strategy. But you need to take it one step further. That's only the first step. The other piece of that is what type of governance is in place for the physician group? What type of management is in place? Because we all know that those type of positions, the CEO, senior leadership team can turn over. And so you don't want to build your relationship just on that alone, because once that turns over, and someone else comes in that position, without a good governance and management system in place, you could be looking at a transaction or a deal that you didn't sign up